Our evidence-based project is focused on pressure ulcers. A pressure ulcer is an area of localized damage to the skin and underlying tissues believed to be caused by pressure, shear, or friction. Pressure ulcers can occur on many parts of the body, particularly bony prominences. Some frequently impaired areas are the sacrum, coccyx, heels, and ears. The pressure on these areas causes a lack of oxygen and nutrients, which results in tissue ischemia, leading to the breakdown of skin. Some people that are more susceptible to developing pressure ulcers are the geriatric population, nutritionally deficient people, those that have impaired mobility, and those that are neurologically impaired. In a stage 1 pressure ulcer, there are no breaks or tears, but the skin feels warmer and is red and non-blanchable. In a stage 2 pressure ulcer, there is a break in the epidermis, dermis, or both. It usually presents as an abrasion or a blister and is superficial. In a stage 3 pressure ulcer, full thickness is lost and breakdown has extended into the subcutaneous tissue, but not all the way through the tissue. In a stage 4 pressure ulcer, the breakdown has extended all the way through the subcutaneous tissue and is now exposing either the muscle tissue or the bone. When a pressure ulcer is unstageable, necrosis of the tissue has occurred. A scar is present and has to be removed before the ulcer can be staged. Preventing pressure ulcers is important because they increase the cost of healthcare, prolong patient stay, increase risk of infection, and reduce quality of life. Insurance companies, such as Medicare, do not cover facility-acquired pressure ulcers, which means that the healthcare facility has to cover the cost. It is important to prevent pressure ulcers not only for the patient, but also for the nurses because time spent caring for these preventable ulcers is time that could be spent with patients that require immediate care. The PICO question that we generated is, among immobile patients who have an extended stay at a healthcare facility, what is the effect of using specialized mattresses along with turning the patient every 2 hours compared to only turning the patient on the incidence of pressure ulcers? We searched various databases and came across 3 research articles about pressure ulcer prevention.
Our evidence came from the Cochrane Library Database, the ProQuest Database, and the Critical Care Nurse Journal. Some keywords that we used were pressure ulcers, prevention, turning, redistribution, and more. Some limits we used were articles written in the English language, articles that were less than 5 years old, and full text articles. The first article we appraised was Support Services for Pressure Ulcer Prevention, written by Elizabeth McGines in 2011. This article is a Level 2 quantitative research article that uses a systematic review study design. The evidence recommends turning the patient every 2 hours and using specialized mattresses that redistribute pressure every 5 minutes.
The second article we appraised was Evidence-Based Prevention of Pressure Ulcers in the Intensive Care Unit, written by Karen L. Cooper in 2013. This article is a Level 5 quantitative descriptive research study based on expert opinions. This evidence recommends turning the patient every 2 hours and heel elevation therapy in addition to pressure redistributing mattresses. The third article we appraised was Assessing Evidence Supporting Redistribution of Pressure for Pressure Ulcer Prevention, a Review, written by Stephen Spriegel and Sharon Sonnenblum in 2011. This article is a Level 2 quantitative research study that uses a systematic review study design. This evidence recommends having the patient on a viscoelastic mattress along with turning the patient every 4 hours.
The overall quality of the evidence from these 3 articles is good, and the practice that is consistently supported is the use of pressure redistribution mattresses in addition to turning. There is inconsistency between the articles about the length of time before repositioning the patient. Based on these 3 articles, we recommend using a pressure redistribution mattress along with turning the patient every 2 hours for patients at risk for pressure ulcers in long-term care facilities. The implementation of this practice recommendation will lead to positive outcomes because it will decrease the incidence of pressure ulcers, increase the quality of life, reduce the risk of infection, prevent an increase in the cost of healthcare, and decrease the patient's length of stay.